Hello, good evening. I'm going to call the meeting to order, and we'll start off with 2.0, and we will have the elections. First one is 2.1, and it's the election of the chairperson. We do have a motion, a recommendation, which is moved by Gary Gunther and seconded by Stuart Kidd, and be it resolved that Scott Robertson be elected chairperson of the Personnel Policy, Labor, Employee Relations Committee for the year 2022. If there's any other nominations or anybody else that wishes to run for the chairperson, please let me know. Hearing none. If there was any discussion that wished to be had. So we'll move on to the recorded vote. So I'll start with Blair.
Yes.
Thank you. Gary?
Yes.
Stuart?
Yes.
Jamie?
Yes.
And Scott?
Yes, thank you to my nominators.
And Marianne?
Yes.
Thank you. So moved. And I'll pass it over to Scott. And thank you so much for putting your name forward. Really appreciate it, Scott.
Thanks, Dr. Chirko, and thanks to my fellow board members. So with that, we'll just jump right in here to the next part of the agenda, which is the election of the vice chairperson. Item 2.2 on the agenda. And so I think we have a recommendation already. Take a look here. Oh, that's for the agenda. I think I skipped it. Here we go. Okay, so be it resolved that Marianne Strickland be elected vice chairperson of the Personnel Policy, Labor, Employee Relations Committee for the year 2022. Moved by Stuart Kidd and seconded by Gary Gunther. Marianne, do you accept the nomination?
Yes, I do.
And I'll just make a call out for any further nominations. Seeing none, I'll pass it to the vote. And we have a bunch of regrets today, so maybe I will just do the vote by looking at the names rather than the list. So I'll go to Jamie.
Yes.
Stuart.
Yes.
Gary.
Yes.
Blair.
Yes.
And Marianne.
Yes.
I got everybody right. And I also vote yes. So the recommendation is, that will be the recommendation from the committee. And Marianne, you are the vice chairperson. Thank you for putting your name forward. We appreciate that.
Thank you.
Okay, so now we're going to move into the regular part of the meeting. Just pulling up my agenda again. I probably should have printed this out for ease, but didn't. Item 3, approval of the agenda. So you've all had a chance to take a look at the agenda. Is there anybody who would like to propose any amendments to the agenda, or is the agenda okay as presented? Waiting for any amendments to be suggested. Hearing none, move forward with the recommendation. Be resolved that the, no, wait, skipped it again. Be resolved that the Personnel Policy, Labor, Employee Relations Committee agenda for May 25th, 2022 be approved. And go around and do the vote again. Jamie?
Yes.
Stuart?
Yes.
Blair?
Yes.
Gary?
Yes.
Marianne?
Yes.
Okay, the agenda is approved. Next, we have any conflicts of interest declarations to be made. Anybody wishing to declare conflict of interest can do so now or at the time the item comes up. Wait for any conflicts of interest. Hearing none. We will move to item 5, approval of the previous minutes. So that goes all the way back to November 24th, our previous PPLER meeting. Everybody has had a chance to review the minutes. Please let me know if there are any amendments, corrections need to be made there. I'll wait to hear for some, to listen for some. Hearing none. Moving forward with the recommendation, be it resolved that the minutes from the PPLER committee meeting held on November 24th, 2021 be approved as presented. Jamie,
Yes.
Stuart,
Yes.
Blair,
Yes.
Gary,
Yes.
Mary Ann.
Yes.
All right, the minutes are approved. What's next? We've got date of the next meeting at the call of the chair. That's me. And I'm sure staff will let me know the next time we need to have a meeting. And so we are going to be going into closed session now to discuss a matter of labor relations or employee negotiations. So go ahead and move this forward, this recommendation. Now therefore be it resolved that the PPLER committee move in camera at 5:08 p.m. to discuss agenda item 8.1, labor relations or employee negotiations. Call the vote. Jamie,
Yes.
Stuart,
Yes.
Blair.
Yes.
Sorry, the street cleaner is going by my house. Gary,
Yes.
Mary Ann.
Yes.
Okay, so I will just wait for staff to let me know when we're in closed session. Okay. That's it for our closed session. Moving on to item number 9, which is new business. Is there any new business? Hearing none, we move to adjournment. Thanks, everybody. And I guess we'll be starting the Board of Health meeting now. I'll pass it over to, well, Nancy's not here, right? Stuart, I guess.
Stuart.
Yes, thank you, Scott.
Good night, everyone.
Night.
Night,
Thanks,
folks.
Isabel.
Thank you.
Sherry, I'll let you know, or let me know when we're ready to roll, please.
Whenever you are ready, Stuart, we are ready.
Okay, folks, we have quorum, and unfortunately Nancy's been held in Southern Ontario en route, but we're going to scramble together in her absence. So the first item is to call to order, and then the approval of the agenda. Any addition of new agenda items or not? Hearing or seeing no hands up. And Sherry, I'll ask you to supplement my visual on the screen. If you see a hands up or somebody waving, please let me know.
I will try.
Okay, well, hearing none, we have a motion to approve the agenda. Moved by Scott, seconded by Mary Ann. Be it resolved that the Board Health agenda dated May 25, 2022 be approved. Jamie, I'm going to go from my screen as you did, Scott. Jamie?
Yep.
Scott?
Yes.
Blair?
Yes.
Gary?
Yes.
Mary Ann?
Yes.
What am I missing down on the bottom here?
That's it.
Then that's carried. Our next item. Approval of the previous minutes. Everybody has had, and I assume read them. Minutes dated April 27, 2022. Any additions or changes or deletions? Seeing no notice of such, I have a motion moved by Gary, seconded by Scott, that the minutes from the Board of Health meeting dated April 27, 2022 be approved as presented. We'll call again. Jamie?
Yep.
Scott?
Yes.
Blair?
Yes.
Gary?
Yes.
Mary Ann?
Yes.
Very good. That's carried too. Thank you. The date of our next meeting is June 22. At a time to be determined, most likely. Run about the same time. 1 second, folks. I'm just moving paper here. Sherry gave me the right heads up and said I should print these ahead of time, and otherwise I'd be scrambling. Our next item on the agenda, item 6, is business arising. Dr. Chirko, is there any business arising that we should bring to the floor?
No.
Anyone else? Hearing none. We'll turn it back to you, Dr. Chirko. Next item, the report of the Medical Officer of Health, please.
Okay, thank you, Stuart. So it was pre-circulated, and I'm not going to go through it all in detail, but I will touch on a few points. With respect to the COVID-19 update, across the province, we continue to see a downward trend. And for those cases of those that are eligible for testing, there's been about a 43% decrease in the 7-day average versus 2 weeks ago. Hospitalizations down about 28% versus 2 weeks ago. ICU admissions, again, down 11% versus 2 weeks ago. The deaths also a 31% decrease in 7-day average versus 2 weeks ago. Percent positivity of the testing is right now around 10%, and it represents about a 23% decrease in the 7-day average versus 2 weeks ago. As well, the outbreaks are down. So all of that is positive. Similarly, we're seeing a downward trend locally. Currently, there are 16 in hospital with COVID and 5 due to the virus. So it doesn't mean that the hospitals aren't, feeling the pressures. They certainly are. They have backlogs that they're working very, very hard to address, as well as when staff do become ill or have to take time off because of COVID. So they are managing, and it has been certainly difficult, but they have not had to resort to any extraordinary means, and everything is headed in the right direction. As far as the immunizations go, again, the numbers are slow and steady, but low as far as the immunizations go. What we're seeing now, and we're providing immunizations throughout the district with certainly clinics and health equity clinics. We have the bus now, and working with First Nations as well. And most of the immunizations that we're seeing right now are in the 18 plus age group, and most of it is 4th doses that we're seeing. So that continues. As far as influenza goes, highly, highly unusual. That basically we started our season in the spring, which normally we start in the fall. Usually it will peak sometime in January, and then start to decline. And then we sometimes will see a small resurgence in the springtime of B virus. But now what we're seeing is that the cases are starting to actually increase over the and May has seen the largest increase and is headed in the upward direction. Mostly A cases, but that's kind of the unusual scenario that we're dealing with. Most of the time in the summer, we might get the odd case, but one thing I've learned over the years is that influenza is highly unpredictable. The other thing of note is that unfortunately the vaccine has not been shown to be very effective. One report was about 16%. However, for those that are high risk, it certainly is something that you would want to certainly consider if it gives you that much of an advantage. Even though it's not great, it is still something, and we certainly don't know what's coming, so that there may be some advantage certainly to having it, but we can't say for sure right now. When I wrote this report, monkeypox wasn't on the agenda, but it certainly is now. And so I'll give you a little bit of a brief update and take any questions that you might have. So overall, I want to start off by saying that the risk to the general public is very low. And the European Center for Disease Control and Prevention has said that for persons with multiple sexual partners, that it is a moderate degree of risk. Now, it's spread person to person, but person-to-person spread is usually uncommon, but it can occur certainly through contact with bodily fluids, wounds on the skin, or internal mucosal surfaces, respiratory droplets, or contaminated objects like clothing or bedding. Now, the current evidence is indicating that it is the West African clade. Now, it's been around for quite a long time. In 1958, it was first identified, and there are two areas where it's what we call endemic. It's in and around the area always, and that's Central Africa and West Africa. And the West Africa, it seems to be the less severe strain, which is what we're seeing throughout the world. Evidence suggests that the monkeypox has not mutated, and that they believe too that the atypical clusters that we're seeing around the world should be brought under control with contact tracing and isolation. Now, locally, we've reached out to our healthcare providers to update them on certainly information, as well as what to be aware of the situation, and what to watch for, and how to test, and to we're working with our healthcare providers for that. In case that they do identify monkeypox in one of their patients, it presents similarly to flu-like illness, and initially. So it is a situation where the real defining sign would be if they really develop after having, the symptoms, which are like the flu-like. For instance, headache, fever, chills, muscle aches, back pain, all those could be similar to what you get, and fatigue, similar to what you might get with the flu. However, this can be more differentiated because they may also get swollen lymph nodes, and that also differentiates it from smallpox, which is in the similar family or genus, as it's called. But when about 1 to 3 days after the symptoms that they may get, a rash may appear. And so with that, that is when you would think of certainly that potentially being the monkeypox. Now, it usually would start on the face and spreads over the body and to the extremities, hands and feet, as well in 75% of the cases. So, as mentioned, it certainly can spread through the contact of bodily fluids, and there's also potential for spread with animals that may have been infected, either close contact with them or consumption. And we wouldn't see too much of that here. Now, the transmission can occur, certainly those that would be at risk would be healthcare workers looking after these patients, as well as household members or close contacts at increased risk of infection. So as far as, when are they communicable? Well, the individuals are communicable from symptom onset until the scabs have fallen off and a new skin is present underneath. And so it's about 2 to 4 weeks. And in most patients, the symptoms of monkeypox are usually self-limiting and spontaneously resolve within 14 to 21 days. Diagnosis is from tests that will be done and are sent to the National Laboratory. And so primary care providers would be responsible for doing the testing. And it's a polymerase chain reaction test, the PCR, very common test that is done. That may take 24 to 48 hours to get the results back. And again, most patients, if they get it, remain at home, do not require hospitalization, and the symptoms are simply treated as you would for other illnesses. Treat the fever, make sure well hydrated, and most patients do not end up certainly in hospital. So again, risk is low for the general population. So at that, I'll just open it up. If you have any questions, be happy to. Or if Dr. Zimblad, if you have anything you'd like to add to that.
No, that's a good summary. Thank you.
Okay, I have a couple of questions, but I'll park them. Anyone else around the table have questions of Dr. Chirico? Seeing none. I have a COVID one, and I don't remember from your report whether you touched on it. Forgive me if you did. The therapeutic for people that have COVID that are in a potentially severe condition, have we had experience here at the hospital where it's been used and successfully?
If you're referring to the monoclonal antibodies,
it's where you have
There's
COVID
been-
and you're progressing severely, and it's a stop to the progression of it going deep into your lungs. Prolapse or something?
Pardon? Plaxavid, you mean?
Maybe that's it, yes.
Yeah, they have used it, but there's really significant interactions with medication that you might be on. So you have to test positive for the disease and then be assessed, and it certainly has to be within 5 days onset of symptoms. Now, I don't know the exact numbers of how much has been given, but it has been used locally, and both in North Bay at the assessment center and also in Parry Sound. Now, Dr. Zimblad may have a little bit more information on the exact numbers. I don't have that.
I don't have any current numbers. I think the last update I had, at least from the North Bay Regional Assessment Center from just over a week ago, was that they had used it over 70 times, and no individuals that they've treated with that have ended up hospitalized.
Yeah. And the hospitalization rates are low to start with in our district. So.
Okay, thanks. And couple related to the pox, one in particular. If you have your smallpox vaccination from way back, is it still good against this?
Yeah, it's. I think from the reading that I've done, it is, and that it is. If I recall, let me just check that the vaccine, the smallpox vaccine, is about 85% effective in preventing monkeypox. 2 doses required now, and that they do have the vaccine, but we don't have any information on who it will be used for. Potentially could be close contacts of high-risk individuals, but there aren't any guidance documents out yet as to how and when it's going to be used, if required.
Okay. And my second pox question is somewhat tongue-in-cheek, but if we got a breakout here in North Bay, my guess is we wouldn't have as much reluctance to get vaccinated, given how it appears, displays. Don't have to
I don't know if vaccinations would be on the table. It would really depend on the situation. Most of it is very self-limiting.
As I say, that was a bit tongue-in-cheek, but thank you. Any other questions? Hearing none. Thank you very much, Doctor. Board committee report. Item number 8. And Scott, I think that begs your comments.
Sorry, my comments. Item number 8.
We're there.
I see the signing officers? No, I must be on the wrong one.
That's after you, that's 9. I think anyways. I have mine here.
We can just
If you
report
wanna-
that there was a Pepler meeting
Okay.
prior to the board meeting and direction was provided in camera. That's all we need to identify.
Sorry about that, Scott. I should have just.
No
said that
problem.
myself.
No problem. My bad. I was on the wrong spot.
The next item on the agenda is, as Scott mentioned, the, under new business, signing officers for 2022 revised, and I have a resolution on that, moved by Marianne, seconded by Scott, that be it resolved that the Board of Health for the North Bay Prairie Sound District Health Unit approve the revised list of signing officers for the year 2022 as follows. Board of Health Chairperson, Nancy Jocko. Board of Health Vice Chairperson, myself, Stuart Kidd. Medical Officer of Health, Executive Officer, Dr. Chirko. Public Health Physician, Dr. Carol Zimbalati. Executive Director, Clinical Services and Chief Nursing Officer, Shannon Mantha. Executive Director, Community Services, Louise Gagne. Executive Director, Corporate Services and Privacy Officer, Paul Massacott. Executive Director, Finance, Isabel Churcher. And Executive Director, Human Resources, Jose Goulet. Any questions on that or comments? I'm going to go through seeing none, I'm going to go through the list. Scott,
Yes.
Jamie,
Yes.
Blair, you're muted, I think, Blair. I'll come back to Blair. Gary,
Yes.
Marianne,
Yes.
Blair, you okay? Yes, you're okay now.
Yeah, yes. Yes.
Okay, that's great. Thank you very much, folks. Now, we have on the agenda in camera, we don't have anything to go into camera for, do we?
No.
No. That was quick. Item number 11, which everyone's waited for, is our adjournment. Folks, thank you very much. Enjoy the weather and keep safe and healthy. Thanks,
Good night,
folks.
everybody.
Good night, everyone.
Thank you.
Good night, everybody. Take
Thank you,
care.
Stuart and
night.
Scott.
Our pleasure.
One second. Perfect, thank you. So we do have 2 media questions. Both come from Stu from Bay Today. So the first is, the health unit indicated it was a late start to the influenza season. Have you ever witnessed such a sharp increase in cases in the month of May or so late in the season? Are flu shots still available at the health unit and at local pharmacies? Dr. Chirko?
Yeah, great question, Stu. Thanks for that. And to answer your question, no, I've never seen anything quite like this, especially in May. With what we're seeing, as I mentioned during the Board of Health meeting and the MOH update, usually we see cases starting in September, maybe peaking in January or thereabouts, and then starting to decline with maybe a little bit of an increase in the spring of B. But now what we're seeing is that the season has shifted for whatever reason, and that we started seeing cases in March, and May has shown the greatest increase, and they're steadily increasing. I'll give you a little bit of a comparison. We drew some numbers, and we didn't have hardly anything until again this spring. But in 2019 and 2020, we had 142 confirmed cases among residents in the region. Now, bear in mind that we don't do a lot of mass testing. So the number that I'm quoting is far less than what is circulating in the community. And so bear that in mind. And then in 2020-2021 flu season, there was only one confirmed case locally. And again, that was with COVID onset. And then, you know, we're currently in the 2021-22 influenza season, and we've had 44 confirmed cases. So again, there's probably a lot more in the community, and the vast majority of them have occurred certainly in May and still on the increase. What the future holds, really can't say. Don't know if it is going to continue like this and increase. Usually this is what the Southern Hemisphere experiences, where their cases occur during our summer, and we don't see very many. So we're not sure what's going to happen as we progress through the summer and into the fall. We do have influenza vaccine available if required.
Thank you. And our next question is something you've touched on in the Board of Health meeting, but just for the sake of the question, what is your advice for the public with respect to monkeypox, the monkeypox outbreak?
Well, thank you again for that, Stu. Very, very good question. And I want to start off by saying, first of all, that, again, let's look at the risk and put it into perspective. The overall risk to the general public is very, very low. And as mentioned before, that the European Centre of Disease Control and Prevention has stated that for those with multiple sexual partners, it becomes more of a moderate risk. So what I would advise to the public really is be aware of the signs and symptoms of the monkeypox. And so that would be symptoms similar initially to the flu, where you may have headache, fever, chills, muscle aches, maybe back pain, and fatigue. You can also get sweating, and the other important thing to note is any sort of lumps and bumps, like lymph nodes that are increasing. And then about 1 to 3 days after the symptoms that you may have, a rash may appear, and the rash may start in the face and go over the rest of the body. And in about 75% of the cases, it'll be on the hands and the feet. Now, being aware of those signs and symptoms is probably the biggest thing to advise people to be aware of. And also do a personal assessment of your risk of infection, sexual contacts, possible exposure to an individual diagnosed with monkeypox or an individual that is symptomatic and awaiting lab confirmation. As well, if you have signs and symptoms of monkeypox, immediately isolate and arrange to be tested by your primary health care provider. And remain in isolation until the results of your test is known. And if you are a contact of an infected individual, you really do, you can self-monitor for symptoms for 21 days and seek medical care or testing if the symptoms present. But you don't need to quarantine if you don't have any symptoms, if you're a contact. So if you have tested positive for monkeypox, you do need to self-isolate until lesions are resolved, meaning that the scabs have fallen off and new skin is present. So if you have questions, you can check our website. We are going to be getting it up quite quickly, information that you may find helpful. And if you still have questions, we'll be able to, we'll post a number that you can call the health unit and be in touch. But again, remember, most cases are very mild and that they are just treated for your symptoms that you might have, and that nothing else usually is required, and most people do not end up in hospital, and it is self-limited, and 2 to 4 weeks it's over.
Thank you. So that concludes our media questions, and so that will end this. Thank you.